Okay. Just from the beginning of the video, you can actually see like Panama City, how actually it is, how futuristic it can be, because a lot of patients or a lot of people may think of Panama like a third world country. It is a third world country, but you tend to think like a jungle or something like that. So at least here at the beginning of the video, you already see that Panama, it's much more advanced than.
Strongman takes a massive toll on your body. I've got degenerated discs, I've got pain going down my leg, and I've got a knee that can't extend. So I went for a $50,000 treatment down in Panama to get myself back to 100% and get the
Okay,
most
he
cutting-edge
mentioned
medicine possible.
$50,000 procedure here in Panama. Obviously, not all the protocols are going to cost that much. The thing is, in his particular case, due to his size, due to his wear and tear, and due to the severity of all of the different injuries, that required a lot more stem cells, a lot more, specialists, a multidisciplinary team of doctors that we were in charge of his care. That camera, what you're doing or you want to do there is making sure they're not too tight together.
Okay.
That the flask is not completely full. If the flask gets to be. So here's something that's very true. I think one of the positive things that we have is that we have our own stem cell bank and our own stem cell processing laboratory that is right across the hall from the clinic. That way, once the stem cells are ready, within the first 15 minutes, those stem cells are going to be applied into your body.
Now let's back up for a second. And what are stem cells and why have I spent so much? No. And why is this such an expensive procedure? Well, stem cells are non-specified cells and they are found in abundance in babies and thus in umbilical cords. Now, this isn't something that's...
Yes, it is found in abundance in babies and umbilical cord. So this is something very important to clarify. The stem cells that we're using are from umbilical cord of healthy babies. So we do not use any babies or any aborted babies for your stem cells. We follow the American Association of Tissue Banking guidelines in order to accept the umbilical cord. Once that umbilical cord accepts all of the different criteria, we do our own series of tests just to measure the potency, the safety, and just repeating some infectious disease and genetic testings. Regarding the potency, is something very important because one umbilical cord can have a different potency than another umbilical cord. So one of the things that's also set us apart is that we actually measure and we standardize our umbilical cord. That way you can expect, consistent results in all of our patients.
Now, this isn't something that's legal in North America for ethical reasons, but those stem cells in the umbilical cords are cells designed to become absolutely anything. Now, if you inject that into a damaged tissue, your body will turn that into that tissue. And so it actually doesn't even matter. You don't even really need a diagnosis. Let's say you have a sore bicep. Well, if you inject stem cells into the sore...
Something important to clarify here that Mitchell is mentioning is we used to believe that stem cells converted or transformed into a part of your body. Now we know that basically stem cells just secretes different messengers or instructions or growth factors in the shape of exosomes that they will signal your own body, your own tissue, and your own cells to do a particular function or an instruction, basically. So now we know that in vivo, inside the patient, the stem cells do not transform into other cells. That is a behavior that you actually can see in vitro. In vitro is in a lab where they can change into different types of cells.
Into the sore area, it could become muscle, it could become tendon, it could become collagen, it could become a variety of things that help you out. Now, I'm gonna flood my body with stem cells. I'm putting millions and millions into my bloodstream through IV and several million throughout my bicep, my knees, and my back, if they decide that that's the right thing for me. And I'm gonna vlog the whole process. So you guys are gonna see exactly how we take stem cells from an umbilical cord into a human being and use that for elite performance.
So you see those little streaks, those are stem cells. So that camera, so right now we're actually seeing the lab. That's the good thing about us. You get to see the lab in which your stem cells are being made and the people working on your stem cells. So it's complete transparency and openness to show you the degree of quality that we're working with.
In a minute, but that's not all that I had done. I also had blood testing done to find out how I can optimize my body for recovery as much as possible in the future. It, of course, went through micronutrient deficiencies and anything they recommend in terms of supplementation, But they also talked about the different things that I should be doing based on how I react to certain foods and inflammatory processes. Not only that, they also did a genetic test where they took my entire genome and I got a full report on every mutation that I have. Private clinic in my hometown.
So that's something very, very important. Most clinics just, this is what I call, most clinics are just drive-through stem cell clinic. You go over there, they give you stem cell, and then they send you off. What Mitchell is explaining is, I think, part of the importance of our protocols and how we can basically have better, longer-lasting results than other clinics. By understanding your genes, I usually call it your default settings. By understanding your default settings, we can understand how your body works and how we can optimize or compensate based on any type of genetic deficiency or genetic mutation. And with a nutritional component, it's also very, very important because we tend to think mostly on the macronutrients, the proteins, the fat, the carbohydrates, but actually the micronutrients is what every single cell in your body uses to function properly. So if you're looking for stem cells for repairing, rebuilding, or regenerating something, we need to make sure that you have all of the necessary building blocks to do so, all of that raw material to do so. And that's why we do so many tests.
Immune system, improve the environment of the stem cell, and also have NAD, NAD.
Yep.
Yeah, also have NAD. So
They all get IVs beforehand as well.
sorry.
Does everyone who gets stem cells, do they all get IVs before as well?
Yeah,
Is it
before
part of it?
always yes, it's part of it. We always put.
So yes, so he's asking if everybody gets IVs before or after stem cells. One of the things that we want to do is making sure that your body is in the best suitable environment. It says, it's a fertile environment for the stem cells. So we do different type of treatments, from nutritional IVs, from detox, different type of therapies, from total plasma exchange, EBU therapy, nutritional IVs, hyperbaric chamber, red light therapy, all of these different things, just to have a much better effect on stem cells in your body.
Myers cocktail first, and get the blood work, and also put the IV from the same patient.
Yeah.
Nice. So with that sample, we're gonna see how the results are going, and if the results go a little bit higher, I'm gonna put in the comment. Mega fit.
So cool.
Yeah. This looks like from a movie. This test, we are gonna measure food sensitivities. Okay.
Oh, cool.
I don't know if you drink coffee and your stomach.
So with the food sensitivity test, it basically measures how different type of foods can affect different immune proteins of the immune system. Basically, you have immunoglobulin G, immunoglobulin G4, immunoglobulin E, and even one called C3D. The idea behind this is understanding how your body reacts to different type of foods to lower inflammation as much as possible. If you keep inflammation low, you're going to basically optimize your body functions, and you're going to be able to recover a lot faster. Particularly in his case, that again, he's the strongest man on earth. So his profession takes a toll on the body.
Excuse the strange camera angle, but today is the day. I'm going in early this morning to get a hyperbaric chamber, and that's supposed to increase oxygen to the cells to make it easier for the stem cells to do their job. And I go from there straight over to get IV stem cells. From there, I then go to the hospital, get put under, and to get stem cells in my back. So I'll have footage of all that coming up. But this morning, no breakfast, gotta do all this fasted. It's the first time I've ever been put under for anything. So we'll see where it goes, and I won't know what it looks like.
So the hyperbaric part of it, from the air that we're breathing at this moment, 21% of it is oxygen. And we, here in Panama, we're at sea level, so it's 1 atmospheric pressure. Whenever you go inside the hyperbaric chamber, you're going to be breathing in 100% oxygen, and it's going to be like tripling the pressure. So it's basically having oxygen being pushed into every single tissue in your body. This is particularly important for those very poorly vascularized tissues, like tendons, ligaments, discs, or joints in general. So obviously it helps improve blood flow, oxygenation delivery, inflammation, and overall recovery. It's important to understand that your cells work the best or produce more energy in an oxygen environment, okay, in a aerobic environment. So whenever you make sure that you have enough oxygen, your cells that basically, if they're repairing, they demand a lot of energy. So you're also making sure that they have plenty of energy for that repair process.
Until this video is made. So a little bit apprehensive, but we'll see how it goes. All in.
Buenas.
See, being put under is basically being under sedation. So basically, they give you a medication, put you asleep, and that's it. You do not feel any pain, any discomfort, and you do not remember the surgery. But it's basically you're put asleep. No intubation. It's just a mild sedation IV.
So you know all that stuff.
I'm not a doctor, but generally, yes.
Okay. It's really important. You need to remember that we have two types of stability in our body. Okay, we have a static stability.
Gotcha.
Okay.
Yep.
Yeah. And the static stability is the bone, the disc, the other disc, and in your back you have two facet joint that is the improve the muscles, we try to improve the facet joints, the ligaments, and for that this is the right, this is the left, okay, and this is posterior too, okay. So when we see this image over here, we see area over here. Look, this is a little gray, and this is not white like this. There's a deep, and you're gonna have like a regeneration process in your back. Okay. In your case, there's a great right now, so it's normal, but yeah, this is the beginning of the regeneration process.
So normal 29.
Yeah. Look over there. There's like, look. This is a little bump over here and another bump over there. But when we outgoing root nerve, this is the other outgoing root nerve. Yep. So your facet joints over here.
Yep.
And look, this is the type of pain you call it that in this direction. That is the cause of that pain. That's the inflammatory process in your facet joints. A good space to the outgoing root nerve here and here. Okay. And in this other place, you have a little like a cut in your disc over here. That is maybe the cause of that sciatica that I told you. Okay, your facet joints are like vertical joints. Okay, and when you try to do a rotation, they do that.
No, but I do that a lot.
Okay,
Yeah.
that maybe is going to gain a little inflammation tissue in that area. Okay.
Okay.
So we're gonna put injection in this direction in your facet joints, and you're gonna try to put the injection in the spinal muscle. Okay, that is a really big muscle over there. I'm gonna put the injection here. Okay.
Okay.
Easy. That's it. Okay. Yeah. Look, this is a really wide disc, so they're in really good shape. All this disc. Okay. This is the classification. This is the normal disc. Actually, this is like.
Now it's time for the big part of why I was down here, and that, of course, is the stem cells. Dr. Garrido talked me through, but they went.
So it's not baby juice. These stem cells do not come from baby. I know it's a funny way to say it. It's just an umbilical cord mesenchymal stem cells. That's just to clarify with the audience.
Pretty much as planned.
Half an hour ago, here we see the normal range. No triangle, the range that we get the cells.
Claro, so over here I'm just explaining him different tests that we do to our stem cells, just to make sure that they're the best product, the highest quality that we can have, and it's a series of tests. Obviously, you want to make sure that you're actually getting stem cells, and that's why we use some biomarkers. It's called CD markers, clusters of differentiations. It's basically a key marker that every mesenchymal stem cell has, that we can make sure that it is actually a stem cells. So we also measure viability, which is how many of those cells are alive, and we also measure any type of endotoxin. any toxin that will be present if there's anything in the bag, any contamination. So that way we make sure that it's a high quality product, it is stem cells, and there's no contamination whatsoever in the bag just before you get the injections or the IV done.
Half an hour ago. Here we see the normal range. We go rango, the range, the ability of the cells, the patient, and the value of the sample. So for each sample, from the syringes, from the IV, for everything, we have this value below 0.2. Get that reaction, and usually it doesn't last any more than 15 minutes.
Oh, really? Yeah, right. Okay, cool. And if it were to happen, it happens straight away pretty much?
We have had both straight away and even later through the day.
Shit.
Right. So whenever they see them in a patient, they offer that service to the patients.
And the criteria would be like full-term birth.
Is, they get something extra.
Claro. So now we're talking about the liquid that stem cells are being diluted with. So we have our own proprietary mix that is, a part of, saline, which is the base, but you also have some electrolytes, some little amount of sugar, and like trace elements. Basically, we want to keep the viability of the stem cells high while you're doing the IV, and we have done our own research on what would be the best transporter, what would be the best liquid in which we dilute the stem cells. Claro. So now we're talking about the amount of stem cells. How do you change or do you determine the amount of stem cells each patient is getting based? In his case, we need to check, based on any type of wear and tear that he may have, and also the size. I was telling him actually, he weighs 340 pounds. It's not the same putting, X amount of stem cells in a 300 pound patient than doing it in a 120-pound patient. So we also do
Something extra,
Yeah,
and the patient gets also something extra for the
sure, of course, for something that's otherwise
thrown away.
useless. Yeah,
Okay, and your stem cell?
cool. What's the viscosity?
No, it's just saline.
Yeah, yeah, right, okay, cool.
It's just
Okay.
so obviously it's not gonna be the same 100 stem cells for you than would be for me.
Yeah, yeah,
Most likely would require a lot more than myself.
yeah, yeah, of course. Why do they put you out for it?
It's a sedation. So obviously, since you're going to be going to the disc in the lower back, they want to have you as still as possible.
Oh, so will I be awake?
It's sedation. So and then you fall asleep.
Yeah, yeah,
You fall asleep.
yeah, right.
Extrascope, the regulars, the range, the reaches.
So now we're going over here. We're going to be doing the approach called suprapatellar recess. Patella is your kneecap, supra above the kneecap. So right above the kneecap, you have like a direct space that you can go directly into the joint space. That way, for me, I prefer it because there's no important structures over there. There's no risk of, important to understand that a needle at the end of the day is a sharp blade. So if I do it over here, I'm not gonna be risking to puncture or to do any type of injury to cartilage, to ligament, to meniscus, none of that.
No, we're stupid. This white color is the patella, or kneecap.
So it's very important to use an ultrasound or image guidance whenever you're applying stem cells, because that way you actually make sure that all of these stem cells are going into the intended place.
Yeah, which, I mean, the left knee is my sword.
It is the morning after stem cells, and I feel sore, but I feel sore like after the strongest man on earth, not anything crazy. I didn't record anything last night because I was on drugs, and that is not an image that I want to put out there. I last night I thought, geez, the stem cells really make you euphoric, and then I realized that it was opioids. So yeah.
Okay.
Today,
So a couple of things.
not
Most
too
of the
much going
patients
on,
do
gonna
have
hobble my
do
way
feel
down to
sore
get some
after the
breakfast.
treatment, and the drugs that he refers are just painkillers. So he wasn't on any opioid. We usually don't. It's very hard to get opioids here in Panama. So it's just regular painkillers. And why do patients have such a strong reaction afterwards? It is important to understand that the main reason why joints are impossible to heal by themselves is because they lack blood supply. If they don't get blood supply, they don't get all of the growth factors that they need to actually repair. So once you inject stem cells into a joint, for the first time ever, all of that tissue are going to be getting all of the growth factor they actually need to repair. So obviously that creates a very drastic response, swelling. That swelling will trigger pain basically, and that will usually last around 3 days. The painful part of it, and it gets better and better every single day. See, we usually don't see many patients walking the day after the injection. We assist them in any possible way that you may need, either with a caretaker or with a walker, with a wheelchair. So we're here and we provide anything you need to be, comfortable during your stay here in Panama. So this is not the usual way to go into the red light therapy chamber or the red light therapy bed. But well, everybody can do it the way they want. No, that he was, he went in facing down. This is the first and only time I've seen a patient getting into the red light bed facing down. Just interesting. Perfect. So most of the patients do stay right next door to the clinic. We have a hotel, if you have seen, very, very beautiful rooms, very nice hotel, and it's just right across the street. We have even a direct connection with the hotel at this moment.
How do you feel? How's your back?
The hyperbaric chamber, as you see over here, it's a two-seater. So you actually are able to sit during your treatment. You do not feel as claustrophobic because you have a very big window over here, another big window of this side. So being seated, it's a lot more comfortable. It makes it a lot easier to do the hyperbaric chamber. And it's roomy enough to fit someone like the size and magnitude of Mitchell Hooper. So as Mitchell was saying, actually the recovery we tend to see most of the results even 3 months to 6 months after treatment. So it's not as quick as most people can expect. But the good thing is that you actually see gradual improvement. So just be aware, be patient, and the good thing about us or working with us is that we do follow-ups every 3 months. So it's not that we never see each other. We're going to be doing follow-ups, making sure and having assessment scales just to monitor your progress, and we can actually graph out the progress to make sure that you're seeing those results.